The COVID-19 public health emergency is coming to an end, and with it, a provision in federal policy that afforded Medicaid enrollees continuous enrollment over the last 3 years. Now, states are looking at how best to unwind some of those federal programs, which could impact millions of citizens. I'm Wyatt Cash with Scoop News Group, and joining us to talk about that today are Melissa Hensley, Executive Leader for Health and Human Services at Google Public Sector, and Dr. Monica Bharel, Clinical Lead for Public Sector at Google Health. Monica and Melissa, thank you so much for joining us. And Melissa, I'd like to start with you, if I may. I'd like to ask, what are some of the biggest challenges ahead for agency leaders to solve during this redetermination period?
Thanks, Wyatt. I think the first challenge is really awareness for their members and citizens at the end of the continuous enrollment provision. And then I think experiences. So how is the members experiencing as they try to redeterminate and go through that process? And if they were disenrolled, efforts to, regain Medicaid or transition to other coverage. I think those are the big challenges right now, not to mention workforce. I think all states and locals have more work than they do workforce to attack this.
And then, Monica, how can generative AI tools help agencies determine the drivers of health in their communities and promote continuity of care throughout the redetermination period?
Well, Wyatt, as Melissa pointed out, ensuring that we have continuity of medical coverage is a critical task for government agencies, really during redetermination and beyond. Equity has to be at the center of designing these processes, making sure that those of us who have the most obstacles to obtaining good health can access the services that they need. And as we head into the fall and winter seasons, we know that we may see more cases of COVID-19, flu, and RSV in individuals who are at risk. And during my years of seeing patients in clinic, I would see firsthand that gaps in coverage can result in individuals missing preventive appointments or delaying care and needing then more intensive and expensive interventions when they get sick. Our focus should really be on avoiding this preventable toll of illness and suffering. I know from my time running a state Department of Public Health that navigating our government bureaucracy can be challenging. The behind the scenes work that is required to keep programs running often requires intensive staff work, sometimes redundant and repetitive work. And technology, including generative AI, really has the potential of helping these systems run more smoothly and serving individuals who need health coverage more effectively. AI has the potential to simplify access to information by simplifying language to improve health literacy and translating to multiple languages and summarizing complex documents. This could allow a community member to find the information that they need and navigate through the process more seamlessly. Additionally, AI can play a role in making repetitive, mundane tasks easier. This frees up agency employees to do the more complex tasks that require advanced problem solving and their creativity and compassion.
And then, Melissa, back to you. States' approaches to unwinding this continuous enrollment provisions varies state to state, right? So what are some approaches your government customers are taking to promote continuity of coverage and streamline re-enrollment?
Wyatt, great question. As I talk to states across this country, they're really working to simplify their re-enrollment process as much as possible. This may involve reaching out, reducing the number of documents required, providing online and phone-based or text-based re-enrollment options, and working with managed care organizations to streamline their re-enrollment processes. As an example, using a document artificial intelligence, this technology could read, score, and digitize that Medicaid application, take it, put it in the right order, lighten, darken it, translate it, as Monica mentioned, into 50-some languages, back into English, load it into a single view for your caseworker, and taking that entire process down to minutes and sub-minutes instead of hours for the caseworker. So back, to your point, just really streamlining things and making sure caseworkers can work to the top of their license. I also think that states are really looking at how to leverage technology to improve any efficiencies and effectiveness of the re-enrollment process. This may involve developing and using online and mobile re-enrollment tools, applications, as well as data analytics to identify and target enrollees who are most at risk for losing coverage.
And then, Monica, what other capabilities should government leaders look to add to their toolkit, as it were, to ensure that their constituents, have access to accurate health information?
It's a great question, Wire. If we think about it, 3 out of 4 people turn to the internet for health-related information. So we know it's a starting point for many people in their health journeys. And we know that people are seeking out reliable information to assist them in those health journeys. At Google Health, we really think about information as one of the determinants of health. And we have a framework that we developed with the National Academy of Medicine to identify authoritative sources of information. And we work to ensure that these authoritative sources are easily accessible in searches and on YouTube and in other places where people can access them. We elevate personal health journeys as well to these platforms. And this allows individuals to have access to not only the accurate data, but also narratives from other people to assist them in understanding their own health journeys and giving them agency and really hope that they'll be able to prevent illness and maintain health as they access the services that they need. Residents really rely on government agencies to have timely, accurate, and accessible information on their websites and shared with them on social media and other platforms. And ensuring that our communications to residents are accessible and available when and where they need them should really be a focus for our government leaders as well.
That's so important, for sure. And then, Melissa, what additional recommendations would you offer public sector leaders and organizations who are looking to add AI capabilities in particular to facilitate access to services?
My first piece of advice would be to start small and scale up. It's important to start small when implementing artificial intelligence and scale up as you learn and gain experience. This will help agencies avoid costly mistakes and ensure that you are implementing AI in a way that's aligned to your needs and in a way that's responsible to your constituents. I would also recommend to be just transparent and accountable. It's important when implementing AI to be clear about how AI is going to be used to make decisions and being accountable for the outcome of those decisions. I think I'd like to give you, if we have time, some specific examples of how AI can be used to facilitate access to public services. Intelligent assistants, so chatbots, but they can be used to provide customer service and support to citizens. They can answer questions, provide information, and help citizens complete tasks, or get an application to the point where a caseworker can then intervene and know that the eligibility is well on its way and go through the final steps in the process of determining that eligibility. One other note I will make is machine learning. So machine learning can be used to develop predictive models that can help identify and prevent problems. As an example, machine learning can be used to develop the models that can identify citizens who are at risk of homelessness or other social problems. And then you bring in natural language processing to the fold. We've been using this in medicine, in health for a while, but I think it can be used to develop applications that can be understood and respond to human language. For example, natural language processing can be used to develop and translate summaries of the piles of complex documents that some enrollees have to submit regularly. So those are, a few examples of how I think AI can be applied safely and responsibly, and some things to think about while you're making those considerations.
And then finally, Monica, as we wrap up here, can you offer any additional recommendations to your peers across the public sector?
Thanks so much, Wyatt. I really appreciate the concrete examples that Melissa shared. And I agree that we could start small and think about this technology as a way to augment the work of individuals in the public sector, not replace them, but augment and allow them to more effectively do the jobs that they're doing, which are critical in order to provide health opportunities for residents across the U.S. And when we, take a step back and look at, these recommendations, taking a step back, we learned a lot during the pandemic. I was in the public sector during the first 2 years of the pandemic, and I saw firsthand that we needed the ability for better coordination across health sectors and between government and healthcare for a real focus on equity and a real focus on the connection between the social determinants of health and healthcare outcomes and the need for accurate, timely data. And the tools for us to improve our systems in these ways are available. The tools are available for us to consolidate data across agencies and health and healthcare systems in order to understand a more holistic view of what contributes to our health. We have the ability to find novel signals of disease to help move to addressing root causes of issues such as the mental health crisis, substance use disorder, and chronic disease. The key is to prioritize this work and collaborate across sectors to equitably improve health outcomes for all of us.
Well, Melissa Hensley and Monica Bharel, thank you so much for joining us and sharing your insights on ways to really harness modern tools, including AI, to provide better outcomes for the public. So thank you so much for being with us.
Thanks so much for having us.
Thank you.